Everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing a medication known as Clarithromycin. Its brand name is Biaxin. And before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. So clarithromycin binds to the 50S ribosomal subunit of the 70S ribosome of susceptible organisms. By this action, it inhibits bacterial RNA-dependent protein synthesis. Now, in terms of indications, clarithromycin is indicated to be used in the treatment of uncomplicated infections of the skin or subcutaneous tissue. This medication can be used in combination with other medications to treat H. pylori gastrointestinal tract infections, especially when there's a duodenal ulcer. It can be used to treat acute otitis media as well as community-acquired pneumonia. Clarithromycin can be used to treat streptococcal pharyngitis, and there's also some other indications as well. Now, before somebody was to use clarithromycin, there are some contraindications that they must clear, as well as some precautions and warnings that they should be made aware of. Patients cannot use this medication if they have a hypersensitivity to clarithromycin or erythromycin or other macrolide antibiotics. If a patient had a history of cholestatic jaundice or hepatic or liver dysfunction with prior use of clarithromycin, they would also not be able to use this medication. And this medication cannot be used with colchicine in patients who have renal or kidney, as well as hepatic or liver impairment. Now, in terms of precautions, it should be noted that acute hypersensitivity reactions have occurred, such as Stevens-Johnson syndrome, toxic epidermal necrolysis, and drug reactions with the eosinophilia and systemic symptoms, also known as DRESS. The medication will be discontinued immediately if any of these are suspected. Clostridium difficile-associated diarrhea has been reported with the use of clarithromycin, so the medication may have to be discontinued if this was to occur. The use of phosphodiesterase inhibitors such as Viagra is not recommended with clarithromycin. Hepatotoxicity or liver toxicity, sometimes severe or even fatal, has rarely occurred with the use of clarithromycin. Fetal harm may occur if this medication is used during pregnancy, so we should avoid using clarithromycin in pregnancy unless there's no other alternatives that can be used. QT prolongation and arrhythmias have been reported. This would be more of a risk in the elderly population or patients who have uncorrected hypokalemia, low potassium, or hypomagnesemia, low magnesium. Now, once somebody is cleared of the contraindications and made aware of the precautions and warnings, and they start to use clarithromycin or Biaxin, the dosing that they would use and the duration of use of the medication would depend on what they're treating. For uncomplicated infections of the skin or subcutaneous tissue, the immediate release formulation may be used at a dose of 250 milligrams twice daily for 7 to 14 days. For community-acquired pneumonia, the dosing would be the same, immediate release formulation, 250 milligrams twice daily for 7 to 14 days. Or they can use the extended release formulation, in which case they would use 1,000 milligrams once daily for about 7 days. As with all medications, there are some side effects or adverse reactions that patients may experience while using clarithromycin, so we'll go over some of those here now. Up to 8% of patients may experience abdominal pain, and up to 9% may experience diarrhea. 8 to 19% of patients may experience a disorder of taste. 4% may experience indigestion, and up to 28% may experience nausea. Vomiting may occur up to 25% of the time, and a headache may occur up to 9% of the time. Some more rare but serious side effects would be QT prolongation, Clostridium difficile-associated diarrhea, anaphylaxis, or hypersensitivity reactions. That's all we're going to talk about today with clarithromycin or Biaxin. As always, I'm very thankful you took the time to go by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. That's it for today. Take care.